Hi, I'm Kelly Alexander, Chief of Staff for the Kentucky Department for Public Health. A lot of questions have been asked about how positive cases of the novel coronavirus in long-term care facilities and other confined populations, such as prisons, are reported on the kycovid19.ky.gov website. This information is posted every day, with a few exceptions. The Kentucky Department for Public Health receives this information from local health departments and long-term care facilities. KDPH then shares this data with the U.S. Department for Health and Human Services, the Centers for Disease Control and Prevention, and others. This information results in questions about legal residence. An individual's legal residence, or domicile, is the location where they have their permanent home or principal establishment. KDPH uses an individual's legal residence to ensure consistency with reporting. And not just reporting consistency for COVID-19 information. This is done without exception when health information is reported. This includes all types of health information, such as communicable diseases like the flu, salmonella, smallpox, or other outbreaks. It includes non-transmissible diseases too, like cancer. Well, what does this mean and why is it important? Well, let's say a Kentuckian is away from home, on vacation, maybe in Florida. Let's say that person has to be rushed to an emergency room. Let's say that person receives a cancer diagnosis after quick tests are done there. The report of this positive cancer diagnosis will identify the patient as a Kentuckian. Using legal residence in this consistent way helps the public, medical experts, and others track many things, including the prevalence of certain types of conditions. It also helps with surveillance of seasonal things, such as the onset and decrease in flu cases. Specific to COVID-19, a facility showing up on the long-term care facilities update should not be interpreted to suggest a particular facility was not prepared for an outbreak. Many of the facilities on the list have reported few positive COVID-19 cases. Several have reported just one positive resident or just one positive staff member. Many of these facilities have reported no additional cases in the weeks, now going on months, that have passed since the facility was added to the report. This indicates commitment to thorough infection prevention practices and other measures, including temporary suspension of visitation. Also, there is potential for error in what is reported to KDPH, potential for error in aggregating or categorizing the data, and potential for error in creating the report that is posted to the KY COVID site. Additionally, at times, a resident of one of these facilities who becomes COVID-19 positive was not actually exposed or symptomatic while at the facility due to hospitalization elsewhere prior to their COVID-19 cases, but is still placed on the list because the positive individual listed this facility as their permanent residence. The intention behind notifying the public about the presence of positive COVID-19 cases is to be transparent. Please, join us in recognizing the hard work that is going into safety and infection prevention in these facilities, and please know that there are many teams working very hard, even around the clock, to help long-term care facilities and other confined populations within our state confront the COVID-19 threat that has upended society. Team Kentucky has really come together to defeat the coronavirus. As Governor Beshear says every night, we will get through this. We will get through this together.